We all know we're in the middle of a mental health crisis, and it's so easy to point the finger at social media. But the real story? It didn't start there. To really get a handle on the challenges we're facing today, with algorithms and everything else, we actually have to go way back to the age of asylums. It's a history that, believe it or not, still casts a huge shadow on the care we get. So let's dig into the deep-rooted cracks in our system and maybe find a promising new path forward.
So here's our roadmap for this explainer. We're going to start with the thing that's on everyone's mind, the digital age. From there, we'll peel back the layers and look at the hidden systemic cracks that make getting help so incredibly hard. Then we'll take a trip back in time to see where these problems even came from. After that, we'll jump back to the present to explore a really powerful solution that's happening right on the front lines of care. And finally, we'll tie it all together and look at the path forward.
All right, let's dive right in. First up, the digital age dilemma. I mean, think about it. This is a challenge that no generation before us has ever had to deal with. And for young people especially, it's a total double-edged sword.
And that, of course, brings us to the big question, the one everyone's asking. Is social media really a risk factor for our mental health? Now, the answer isn't a simple yes or no, but when you look at the data, a pretty clear and honestly concerning picture starts to emerge.
So the thing is, the risks aren't really one size fits all. It really depends on how you're using these platforms. The research is pretty clear on this. You've got frequent social networking, which studies link to symptoms of depression. Then you have the image-based platforms, which are often tied to body image concerns. And get this, even just general, casual use can mess with your sleep and ramp up anxiety. And that's not even getting into the peer-to-peer stuff, like cyberbullying and that constant nagging pressure of social comparison.
But here's the thing. It's not all bad. We can't just paint social media as the villain in this story. For a lot of young people, it's actually a lifeline. A whopping 81% of teens say that social media makes them feel more connected to their friends. It gives them a real sense of community. And it's this paradox, right? This contradiction. That's what makes this whole issue so incredibly tricky to navigate.
Okay, but the digital world, that's really only half the story. Because let's say a young person does decide to get help. What happens then? Well, all too often, they hit a wall. And I'm not talking about a digital one. I'm talking about a wall that's built right into the structure of our healthcare system. This is about the basic struggle to just get help.
Just look at this number for a second, 10.1. So what does that even mean? It means that a child's visit for mental health care is over 10 times more likely to be out of network than a regular visit to their pediatrician. Let that sink in. 10.1 times. Can you imagine what that means for a family? We're talking higher costs, mountains of paperwork, and this desperate, frantic search for care that they can actually afford, all while their kid is in the middle of a crisis.
So, what's going on here? Well, it all comes down to something called the parity problem. Now, there's a federal law that says insurance for mental health and physical health has to be equal. Simple, right? But in reality, it's a completely different story. Most insurance plans just aren't in compliance. They push mental health visits out of network, they pay psychiatrists less than other doctors for similar work, and this creates these infuriating ghost networks. You know, those long lists of therapists in your plan who, when you actually call them, aren't taking any new patients. It just makes the whole search feel completely impossible for families.
So, how on earth did we get here? To really understand why these problems are so deeply baked into the system, we need to go back, way back. So for our next section, we're going to take a look at the history of mental health care. And it's a story that, well, it really is a journey from chains to compassion.
This quote, it's from an investigation into one of the world's most infamous early asylums, Bethlehem Royal Hospital. You probably know it by its nickname, Bedlam. And for centuries, this was just the reality. People with mental illness weren't seen as patients who needed help. They were seen as inmates, people to be locked up, controlled, and far too often treated with unbelievable cruelty.
You can see on this timeline just how long and slow this journey was. It really started with these small, humane acts, like in 1792 when Philippe Pinel famously unchained patients in Paris. It took decades, but in 1845, a law finally officially called them patients, not prisoners. But then, progress just kind of stalled. By the early 1900s, asylums had become these huge, overcrowded warehouses, more about custody than care. The first real revolution didn't happen until 1952 with the discovery of the first antipsychotic drug. That was a game changer. It suddenly made it possible to treat people outside of an institution, which led directly to the push for deinstitutionalization in the 1960s, the idea of moving people out of asylums and into community centers.
And the philosophical spark that really started all this change?
It was called moral treatment. And you have to understand, for its time, this was a radical idea. It basically rejected the whole idea of chains and dungeons and instead argued for compassionate care. The goal was to help people through simple things that we totally take for granted now: rest, conversation, having meaningful work to do, all in a calm environment. It was, really, the first time the system even began to recognize the basic humanity of the patient.
So that brings us full circle, back to today. And our next section feels like the modern-day version of that same compassionate idea: prevention in primary care. We're talking about moving mental health care to a totally new and much more accessible front line.
So, what does this new frontline even look like? Well, you've got amazing organizations like the Ames Center, and they're pushing this simple but honestly revolutionary idea. What if we just integrated mental health care directly into primary care? You know, treat the mind right where we treat the body. If we do that, we can make getting help so much easier, so much faster, and hopefully, finally, free from stigma.
And this represents a really, really important shift in how we actually help people who are in crisis. The old way of doing things was something called a no-suicide contract, where you basically just asked a patient to promise they wouldn't hurt themselves, and the research shows that's totally ineffective. The modern evidence-based approach is something called a collaborative safety plan. It's not about a promise, it is all about a plan. It's a real tool that actually empowers the patient, giving them concrete steps to take and lifelines to use when they need them the most.
And what's great is that this whole approach is built on a really clear, systematic protocol that basically any clinic can use. It's just a logical set of steps. Step 1, you proactively screen everyone to identify who might be at risk. Step 2, you assess how serious that risk actually is. Step 3, you respond with the right level of care for that specific risk level. And Step 4, and this is so important, you follow up. You make sure nobody falls through the cracks. And here's how that response gets tailored. If the risk is what they call non-acute, the patient can be safely managed right there in the primary care office. The team works with them to create that collaborative safety plan and talks about limiting access to anything dangerous. But if the risk is acute, meaning it's immediate, the protocol is just as clear. A staff member stays with that patient at all times. No exceptions. They contact a crisis team and they coordinate safe transport to a place that can provide a higher level of care. All right, so let's connect all these dots and talk about the path forward. We've looked at the new pressures from our digital lives, the old, frustrating failures in the system, the really long history of care, and these new solutions on the front lines. So, when you put it all together, what have we really learned? Well, a few key things stand out. First, our digital lives are a brand new, super complex factor in youth mental health. Second, those deep systemic barriers, especially around insurance, are huge hurdles to getting care. Third, our understanding of all this has been a long, hard-fought journey, from punishment to actual treatment. And finally, and this is the hopeful part, despite all the challenges, there is a promising path forward with these proactive, evidence-based solutions that actually meet people where they are.
You know, we really have come a long way. The evolution of mental health care, from actual physical chains to clinical conversations, that is a testament to centuries of progress. But it's also clear that our work is nowhere near done. So I'll leave you with this question to think about. What is the next great leap forward that we need to take for our collective mental health?